Hi, good evening. My name is Dr. Wes Newfer, and thank you for joining us for our virtual CU Anschutz Wellness Series, Happy and Healthy Hour. We're thrilled that you're taking time today to connect with the CU Anschutz alumni community and focus on your wellness. I am an alum of 1999 in the CU SCAG School of Pharmacy, so I'm a pharmacist and associate professor there. I work in experiential programs placing students across the state, and I also do work in endocrinology and in diabetes. For those of you who are attending your first Happy and Healthy Hour, this series was developed to provide practical tips to support your self-care as health professionals. The series covers topics from sleep health to the positive effects of animal connections to burnout in healthcare professionals. Today, we bring our campus expertise onto a topic that affects all of us, managing your mood and enhancing wellness through COVID-19. And I have the great pleasure to introduce tonight's speaker, who is Dr. Alex Reed. Dr. Reed is the Director of Behavioral Health Education at the CU Family Medicine Residency and is an assistant professor at the Department of Family Medicine at the University of Colorado School of Medicine. He has a very fascinating resume. Dr. Reed has worked across the U.S. in family medicine as an educator and clinician for 19 years. He's been a team psychologist for the Denver Nuggets since 2018. He also was a behavioral health liaison for Echo Colorado for 2 years. He holds a doctorate in psychology from the Illinois School of Professional Psychology, Chicago, and a master's in public health from the University of Kansas. Dr. Reed completed a 2-year fellowship in primary care psychology from the University of Massachusetts School of Medicine and a 1-year public health leadership program from the Kansas Public Health Leadership Institute. His current research and educational interests include behavioral health and primary care, using improvisation skills to enhance communication skills in healthcare, and training community workers in brief behavioral skills. All right, so it is my pleasure to turn it over to Dr. Reed. Dr. Reed, it's all yours.
All right, well, thank you so much for that really nice introduction. And so with that, I'm delighted to be here to talk with you all about managing your mood and enhancing wellness. So let's see. Oops. There we go. Let's see. So, oops, I already messed up. So that's one thing in improv. When we make errors, we take a bow so that way people can clap. So my bad on that. I was supposed to go through some of these. So sorry, Wes. My apologies, and this is me, and let's get to the talk. So what the objectives of this talk are really is that I'm hoping by the end of this, you'll learn to identify and figure out signs that when your mood is getting to be concerning for you and troublesome during stressful times. And wow, are we in some incredibly stressful times at this point. I'm going to go over a lot of different tools. And so this is really a menu, a potpourri, if you will, of different behavioral health tools that you can play around with. Some that you may be familiar with, some that may be new for you as well. But we're going to go through and even try out a little bit of some of them. And then really talk about what are some additional resources and strategies to help manage isolation and connect with others, because our worlds have all changed. Where previously this talk would have been done in person, now we're doing it over Zoom. So there's a lot of changes to contend with, and our worlds are shifting at an incredible pace. Okay. And so I want to show you, this is to me it's a pretty striking and powerful picture of, this is Hurricane Katrina, just as it was beginning to make landfall. And there was a tremendous amount of uncertainty of what was going to happen when this storm hit. And it reminds me of just some of the things that we're going through right now, where we're in an unprecedented time, and with incredible levels of uncertainty. And we're also just receiving so many different messages, of what's happening with COVID and with racial injustice, and there's a lot of information to manage, and this absolutely is having effects on people's mood and stress level. So this, in particular with COVID-19, it puts us all at risk for experiencing in mood symptoms with all the changes that are happening, where we can experience fear and worries about our own health and the health of our loved ones, especially those who, may be older or have multiple health conditions. We can have sad feelings. There may be changes that we're experiencing in our own eating patterns where I may have had a healthier diet, now it's not quite as healthy. There may be difficulties sleeping, especially with just all of the stress we're all experiencing. Difficulties with focusing and concentrating. People may be experiencing irritability, so getting frustrated and easily angered. We're seeing this happen quite a bit in the public when folks may be wearing masks, and they're around those who may not be wearing masks. And fatigue, feelings of restlessness. So a lot of different symptoms, and there may be others here that come to mind that you may be experiencing as well. Pessimism and hopelessness. When is this going to get better? When are we going to get out of this as well? So I'd like to open this up to the audience. So we have a poll for you, and so there's a few choices for you. So what mood symptoms have you been experiencing during this pandemic? So please, you can just choose an answer, and then that'll pop up, and we can talk a little bit about that. All right, so thanks for filling this out, folks. We're seeing quite a bit here where people are experiencing some symptoms of anxiety and depression, as well as just anxiety as well, or just feeling somewhat anxious. So thanks for sharing that. And it's interesting to take these results and compare these to what have been what's been looked at in the general public. And so this next slide shows this was a poll that was done and a survey done of US citizens back in March. So about the end of March, and looking at who was experiencing feelings of anxiety or some depressed symptoms in the past week. And quite a few folks, similar to our poll, actually were experiencing both of some of those symptoms of anxiety and feeling down as well. And some of these same questions have found similar rates as well. So what to do when you're feeling down during this outbreak? We've certainly received a stimulus check. There's things happening in Congress where they're trying to come to agreement. One person suggested that we're all experiencing symptoms of panic attacks, and we just need lots of Xanax. So this would be one of the COVID relief efforts that could be done, but definitely not good for your health in the long run. So what can we do? So the first thing is making sure that you're doing something pleasurable. There is an incredible amount of research behind this tool called behavioral activation. For many of us, we may schedule activities of things that we have to do. They may be meetings, doctor's appointments, but are they necessarily things that we're looking forward to? Scheduling those activities can absolutely have an effect on your mood. And what researchers have found is that as people engage in pleasurable activities and specifically schedule them, this can be as effective as cognitive therapy and some antidepressants. So just the mere act of doing this can enhance your mood and have long-lasting effects. and work as well as a medicine. And this is actually one of the charts that I use and encourage folks to do. So the idea is you can sort of mentally plan it. We know that if you write it down, if you perhaps put it into your Outlook calendar, you're more likely to do this. And so the idea is scheduling one pleasant activity, and then putting this in, thinking about, when are you going to do this? Did you do this? Yes or no? And then how was your mood before and afterwards? And this can be an opportunity to see, as I engage in this, it really does have an effect on my mood and helps me to feel better, feel at peace, feel relaxed, whatever that may be. So this is something that I generally, for all the folks that I've worked with over the years who may be experiencing depression or anxiety, this is something that I highly recommend. Okay, so the next one is deep breathing. Deep breathing is wonderful for setting off your relaxation response. The fancy term is your parasympathetic nervous system. We all have the fight or flight system in our bodies, and it's a good thing we have it. We wouldn't have survived as a species if we didn't have the fight or flight system. However, it can be set off, and it can be set off, when we're in danger, and maybe even when we're not in danger, but we're having, we may be exposed to something that's setting that off. So the news can be a great example of starting to set off that fight or flight system. So deep breathing is a way of setting off your relaxation system, which is not automatic. So it's something that you have to train your body to do. And so what we're going to do is we're going to do this particular type of breath. And so I'm going to just show this to you, and we can do it all together. And so what we're going to do is we're all going to take 4 breaths, and I'm going to demonstrate, and then you can follow along as well. But just to sort of go through it, what you're going to do is you're going to exhale completely through your mouth. You'll then close your mouth and inhale quietly through your breath for a count of 7, though. Don't feel compelled to hold it if that's uncomfortable for you. So do it just as long as you can, up to a count of 7. And then exhale completely through your mouth, making a whooshing sound, and doing this to a count of 8. So this is known as the 4-7-8 breath. So let's go through this. So we'll just do 4 breaths, and then hopefully that'll help calm and settle you even more. So here we go. Okay, that's 1. So let's do a second breath. Good, that's 2. Okay, that's 3, and last 1. Okay, thanks for trying that out. I know I feel relaxed. I think I need to do this for more talks. All right, so deep breathing, great tool. And the wonderful thing about deep breathing is that generally no one knows that you're doing it. So it is for you and you alone. And you can do this, when you're walking, maybe when you're on a Zoom call, when you're driving. So very, very portable. Okay, let's go on to the next one. So mindfulness and meditation. So mindfulness, there's a lot of information out there. You may have heard quite a bit about mindfulness and meditation. Many of us who are providers have access to the Headspace app. So they've provided a free 1-year subscription for those who are healthcare providers or working in healthcare. So that's something that's a great freebie out there. And there's a tremendous amount of research demonstrating the benefits of mindfulness and meditation. So mindfulness, though, to define it really, it's paying attention to one's experience in the present moment. It involves observing thoughts and emotions from moment to moment without judging or becoming caught up in them. During a practice session, when the mind wanders, the meditator ideally takes note of where it goes and calmly returns to the moment at hand, perhaps focusing on the breath, bodily sensations, or maybe even a simple yoga move or a mantra as well. So the research, as I mentioned, is really compelling about the benefits for this. And a study from 2015 in the Lancet, a randomized control trial, found that mindfulness and meditation is as effective to prevent relapse of depression as maintenance antidepressant therapy. So, I mean, some people have said that the research that has been shown, the research is starting to get kind of boring because it just keeps showing all these additional benefits. And the other plus is that there's very few side effects to doing this. So, however, it can be a challenge, to suddenly quiet your mind and focus on your breathing, can be really difficult to do. And that's why tools such as Headspace can give you those small steps to try it out, starting maybe just doing this for even a minute and building up from there. Another great app that's a freebie that I highly recommend, it's called COVID Coach. And so it was developed by the Veterans Administration. It's a freebie, and it has lots of different tools in there, from helping with sleep hygiene to mindfulness activities to breathing exercises. So I can't recommend it enough. And like I said, it's also free as well. But once again, great tool. It's one that I've strongly recommended to the NBA Nuggets players that I work with. So they also get free access to Headspace, and a number of them have been utilizing it. And for those who are fans of the Bulls, and especially during the Jordan years, so Phil Jackson is a tremendous mindfulness meditation practitioner, and that was something he did with all of the players, and it was built into their practice sessions, and many of them found great utility with it. Okay, so the next one, this one probably is not going to be a surprise to you, exercise. So exercise is just fantastic for mood symptoms, can be helpful for depression. And, the way I kind of think about it is, if we could put the benefits of exercise into a pill, all of us would take that pill every single day. So, but the big thing is too, is that, it starts slowly, and choose something enjoyable. Many people that I've worked with over the years, as I've recommended physical activity, or that's something that they've wanted to do as a part of behavioral activation, they will remember that they used to bench press like 300 pounds back in the day. And so that's what they're going to go do. And then they go do that, and they're incredibly sore, and then they don't want to do it. So for some time, so start slow, easy does it. Tremendous benefits though that folks can find. Okay. Cognitive disputation. So this is one I really like. One I utilize frequently. It's one I use myself as well. And so, the idea behind it is that, when we are stressed out, when we are overwhelmed, it is easy for us to have negative thoughts about ourselves, about others, about the world. And with all that is going on with COVID-19, with racial injustice, all of that is weighing on us in so many different ways. And it is so easy to have negative thoughts. And there are different types of negative thoughts that we can have. We can have, catastrophizing, where we think the worst thing is going to happen. We can have very extreme thinking. We can also, one type of thinking we can have is should thinking. it's like, oh, I should do this, I should have done that, I should have done that. The psychologist, a psychologist dad joke that I sometimes share is, that when we're feeling stressed and overwhelmed, we can have these should statements, and we can be at risk of shoulding all over ourselves. So my apologies. It's one of my standard psychologist dad jokes. I don't have that many. But with that, when we have these types of thoughts, they lead to emotional consequences, and they can then lead to, reduced activity levels. I'm feeling bad about myself, negative thoughts. Yeah, I don't feel like going out and doing that pleasurable activity. And so it can lead to this vicious cycle and downward cycle. So one strategy is questioning your thoughts, and as you can see here, it can be asking yourself a thought when you're having these moments. You're asking yourself these questions, like, if my best friend or someone I loved had this thought, what would I tell them? And what I love about these is that they really can force you to pause for a moment. I think about when my kids were much younger, and we might go out for a hike in the woods, and as we're walking along, they're asking questions like, what's that, why, and so forth, and we wouldn't get very far because of all the questions they would ask. And I love that they ask all those questions, but they were super disruptive as well. And this is one way of using those types of questions. And the other part that I really like is that these types of questions can help to pull in your inner advisor. So we all have an inner advisor, and we are often much more empathic and generous to others than we are to ourselves. And these types of questions can really help to, allow yourself to be kinder to yourself, and pull in your inner advisor, because you would give great advice to your best friend or someone you loved. So, and I'll tell you one. I learned one technique from a patient of mine that I really liked, and I've shared with hundreds of people. Is they took the question that they liked, and then they actually put it on. They wrote it on a Post-it note. They then took a picture of it and put it on the home screen of their phone, so that way they could see it. And your home screen is generally private, and whenever they were noticing these negative thoughts, they could then just pull up their home screen and ask themselves a question. All right, let's go on to the next one. This is one of my favorite tools, the 3 good things exercise. And this comes from some of the work done at the University of Pennsylvania with Martin Seligman and the Positive Psychology Lab. And the idea behind the 3 good things exercise is really, it's almost a mindfulness exercise, in helping you to learn to pay attention to what's going on in your day. So what you do is, for each day, for at least 1 week, write down 3 things that went well for you that day. The items can be relatively small. So it could be something like, my partner made the coffee today, or large, I just got a huge promotion. You then give the event a title. So, my daughter made a hilarious joke. And then you're going to write down exactly what happened in as much detail as possible, including what you did or said, and if others were involved, what they did or said. You'll then include how this event made you feel at the time, and how this event made you feel later. And then explain what you think caused this event, why it came to pass. And when you're doing this, use whatever writing style you please. Don't worry about the grammar, and use as much detail as you'd like. And it was interesting. I recently was recommending this to a patient of mine, and they distinctively said, you know what, I have to write this down. If I write it on my computer, then I'm going to get distracted by other things that I have on my computer, and so I need to keep this separate. So they made the effort to then have a little journal that they use to write this on. So I thought that was great advice. So there's been some interesting research done with this at the University of Pennsylvania. And so Martin Seligman and his colleagues, they did this they did the initial studies with university students. And these were students who were exhibiting depressive symptoms. And what was fascinating was that if you look at those who engaged in the 3 good activities versus the placebo control group, where they just did their usual activities, what these researchers found was that, I mean, there were immediate benefits to this in terms of their depressive symptoms. And this activity that lasted 1 week, the results, the benefits of that lasted up to 6 months. So 1 week intervention, tremendous benefits that can be so useful. And I've actually recommended this to a number of the NBA staff that I just consult with, where since they're in the bubble and away from family, that they can do this, and then their family members can do this, and then they can share the good things that they observed for that day as a way of also helping to connect. But it is something you don't have to, you can do with family members or partners also at home as well. One of the things I've loved is, I'm personally grateful for, and I have appreciated, is just that 8 p.m. howl over the many months, and just sometimes I participate, sometimes I don't, but it makes me feel good, and I feel connected with the community. Okay, continuing on. Next is social connections, and we are social creatures, so we need relationships, and there are many ways that we've been doing this. Now that we've been isolating, as our work settings have changed. I know the Anschutz campus is for the most part like a ghost town right now, and so yet but when many of us were on campus, we had so many relationships and connections there. So I want to just read to you a quote from a psychologist, Dr. John Arden. He's someone who I did a training with many years ago, and really I like some of the things that he said just about the benefits of social connections and social networks. So he stated, "We have these social brain networks that need to be fostered and kindled and cultivated through a lifetime. And those people who don't do this tend to get more depressed, more anxious, get ill more often, and get dementia symptoms much earlier than others. For example, we know that the telomeres, which are the caps on the ends of chromosomes, actually shrink with loneliness. So social connectivity, as in good quality social relationships, has multiple benefits to our immune system and to our mental health, even down to the chromosomal level." And so, just ensuring that, you're doing something to remain connected. We've had, many of my colleagues and friends, we've had game nights that we've done over Zoom. I've actually been involved in some improv classes and trainings over Zoom, and that's been a lot of fun as well. So, but making sure that that's something you do, because it can be easy to skip that, and yet that is a crucial part of our formulas to help us feel good and maintain better mood and help us with stress. Okay. So the next one is the idea of putting feelings into words. And when you talk to others, it can absolutely help people to feel better. And especially when you share the actual feelings that you're experiencing. So there's been some very interesting research that's been done over the years, in particular, at the University of California. These researchers looked at what happens when people are experiencing a particular emotion and actually share that emotion out loud. When they do that, it actually reduces the level of stimulation in the amygdala, and the amygdala is part of our fight or flight system. And so the idea is actually when you say how you feel, you will feel better and you will feel less distressed. And it's interesting because I think about once again going back to my kids and what I've seen with them over the years. My kids, when they were feeling mad or scared or worried, they would say right away, I'm scared, I'm mad, I'm happy, I'm sad. Adults, we don't do that as easily. So we may use words such as stress, or we may be more likely to describe what someone's doing rather than talk about how we're actually feeling. So when you just say how you're feeling, that is cathartic and will help you to feel better. So it's one of the reasons why I think psychologists and psychiatrists and social workers and counselors, that's why we always ask, so how does that make you feel? So it's our stereotypical question, and it really does lead to changes in what's happening with your brain when you ask that question and put those feelings into words. But with this also, when you're talking with someone, make sure it's someone with you trust, and making sure it's also the right time as well. There are times when when it may be calmer for you, or it's the right moment, and not doing it at the wrong time. So writing out your feelings can also be incredibly helpful. So you'll see the resource here on this slide. Dr. James Penneker, who's been down at the University of Texas for many years, he's got a large body of research looking at what happens when people write out their feelings. And when people hold in their feelings and thoughts, their negative thoughts, it can affect immune functioning and can affect diseases as well, and mood. When people write out about these upsetting experiences and feelings, it can help them to improve their immune system and reduce stress. So writing it out, great benefits. And a lot of folks that I've worked with over the years, this is one of the classic interventions that many people will use. So I'll suggest it, but a lot of people do this already, where they'll journal and write out. You can review some of this information, and with that, there's some very specific ways of doing that. You can also look this up at one of the references in this talk at the Greater Good Institute at Berkeley. Nutrition. So, all of us, our bodies are like a fine-tuned sports car, like a Ferrari. Unfortunately, though, if we don't eat well, then we are at risk of just harming our finely tuned machine. And it's tough. In this pandemic, it can be very easy to reach for food that is not healthy. And so that's been a struggle for a lot of folks, and yet nutrition can have a tremendous effect on the structure and the functioning of your brain, and ultimately your mood. And so how can you do this? And it's tough. The Western diet, our diet is not so good. And there's so many things that, treats that when we're feeling stressed and overwhelmed, tired, that we can reach for, that then have an effect on our mood, on our functioning, on our sleep as well. And so, with this, I encourage you to think about, how can you in this pandemic and this time of stress, think about look at your diet, and if you're noticing that you're not eating so well, how can you modify that? There's a new field that's been developing over the past 4 to 5 years, titled nutritional psychiatry, and it's this idea of really looking at what do you take in, and then how does this have an effect on your mood? And a number of trials that have been going on have found that one of the best diets is the Mediterranean diet, and how this can have an effect on your mood, and reduce symptoms of depression. And uh, and so thinking about, okay, how can you um, increase your helpings of fruits and vegetables and olive oils and fishes and so forth, and reducing sweets and meats and so forth, and thinking about, there's also, it'd be interesting to see as well. I know there's a little bit of research starting to look at, when people are engaging in intermittent fasting, how that have an effect on mood as well. More to follow on that, though. I know there's some preliminary research looking at that. Sleep. So, sleep is can be very challenging during this pandemic, where first, many of us are on screens for a significant period of time. There's a lot of information that's coming at us that can be very upsetting, and in uncertainty, that also can have an effect on our sleep cycle as well. We'll soon be, the light will be changing, and we'll be moving into the fall, not too far off. So it'll be cooler, which will be lovely, but then also the amount of light that we'll be getting can have an effect on mood. And so, one of the things that I recommend for folks is just in general, when people are finding that they're having sleep problems, one of the biggest things that people can do is stay in bed and try to will themselves to sleep. And that does not work. What happens over time is that eventually, bed becomes the place where you don't sleep. It's where you toss and turn. And so if you're having trouble if you're having trouble falling asleep, then ideally, within 15 to 20 minutes, get out of bed. Do something boring and relaxing. Don't, turn on the news. I wouldn't recommend doing screen time on your phone, because that will, you'll get exposed to blue light, and blue light tells your brain that the sun is rising and it's time to wake up. So that can be stimulating. So really doing something relaxing, boring. And then once you start to feel sleepy, then go back to bed. And the idea is really to reconnect your bed to being asleep. And if you find that you're going back to sleep, you start to wake up again, get out of bed. And you just want to keep doing this over and over until you do fall asleep. You may experience a brief period of sleep deprivation. This helps to reset your clock, though, your biological clock, your circadian rhythms. So that way you're more likely to then fall asleep more successfully. The other things you want to do is, setting up your sleep environment for success. So, making your bedroom like a cave, where it is dark, cool, and quiet. So using things like earplugs can be helpful. Using an eye mask can help to just block out light, if, depending on what your room is like, and, making it cool as well. Limiting exposure to the news. There is so much information, and as I've mentioned multiple times, coming your way, and it can be incredibly upsetting. Whereas you're watching things, you might find that your blood pressure is raising. You're having to reach for a bag of Oreos, and it's stressing you out. So thinking about how can I limit this, and maybe doing a little bit less, and what might be some other things that I can substitute in that may be more healthy for me and beneficial at this time. So those are, all those tools, there's a lot of information that I've thrown out at you. And my hope is that, you'll take, there might be some that you're interested in, maybe things that you're doing or used to do that, that you found helpful in the past but forgot about. But one of the bonuses that I love about all of these tools that I've gone over is that they work great for kids. So, these are things that you can easily utilize with with children. So I've done this with my kids. So we've because I have the Headspace app and the COVID coach, that's something that they've downloaded onto their phones and use as an app. And so we've all played around with doing different mindfulness exercises, and that's been a lot of fun. And we've also focused on trying to eat healthier as well, because it can be real easy to think about, okay, Twinkie or kale salad. And so, but when they're making something, then they're more likely to eat healthier as well. So I'd like to open this up now to the audience. So, I've thrown a lot of tools out at you. So please, just pick, and you can pick as many as you want. What are the tools that you've tried? I'll be interested to see what the audience picks. All right. Well, great to see that we've got a lot of healthy eaters. So that's great. A lot of people who are exercising. That is outstanding. So I'm really like, as a clinical psychologist, this warms my heart to see, especially the exercise piece and healthy eating and mindfulness meditation and so forth. So wonderful. And also talking with trusted people as well. So great. So now for the next one. So, so what do you think you're going to do? There are the ones that you're doing already. Is there something else that now you'd like to try based on, what you've learned from this talk? So go ahead and vote. All right. It'll be interesting to see what you all choose. All right. Well, so good to see. I'm excited that that you're all a lot of you, at least 54%, are interested in trying the 3 good things exercise. So and great that folks will be doing behavioral activation. And great, wonderful to see. So with that, let's see. I think I'm now gonna open it up to. Oh yeah, I just wanted to say, if these feelings ever become so overwhelming for you, then please contact your healthcare provider. So do not sit and suffer with this. So there are a lot of great tools, a lot of folks out there who would be glad to help out as well. So don't suffer alone and silently. And these are just some of the resources that I utilized for this. And just to go back over the objectives, I'm hoping that with this you've got some ideas of how to identify the signs of mood concerns that you can experience during these stressful times. You've learned some evidence-based tools that you can use to boost your mood, and that there are resources and strategies that you can use to manage isolation, connect with others, and to help enhance your mood. So yeah, so let me now I'll open it up to to questions. And let's see. So I've got one question. So I'll just read this out loud. Are there suggested behavioral activation activities with evidence of enhancing mood? Really, it's something that I would say, something that you've done in the past that you've enjoyed, but maybe you haven't done it because you've been busy, or perhaps if you've been feeling overwhelmed. Or it could be, I mean, there are actually lists, and that's something that I don't know if we can make, that's something we can make available as well. So there are lists out there of generally, activities that most people would consider pleasurable, and they can review that. And but also one that's an easy fallback is physical activity. So that's one that I generally recommend. If folks can't come up with something, even going to take a walk can be something that people may find pleasurable. And they can even do the 3 good things exercise while they're taking their walk, so they could look for things perhaps that they noticed that were striking to them, or perhaps made them feel good. Great question. So the next question is, so what is the significance of the whoosh sound during deep breathing? The purpose behind that is really to exhale, so whoosh, and really it can just be a way of helping people to focus on, I'm getting all the air out of my lungs, and so with that, it can then help them to just bring in a great deep breath as well. So mostly it was something that I learned from one of my mentors. Okay. Other questions that you may have. Glad to, oops, I just dropped my mouse. My apologies. Yeah, other questions that you may have, or things you've been wondering about? All right. Okay. I just saw this one in the Q&A. Great, thank you. So if you notice some of the changes from stress in a loved one, what do you recommend someone should do? I think one of the best things you can do is to share your observations, and to share the concern. And, doing that in a way that is compassionate and kind. So, could be using words such as, I've been noticing, and generally I recommend focusing on a behavior. So it's something that is seen and can be a little bit more objective. So, I've noticed that you've been having trouble sleeping, or that you've been, after you watch the news, you get really angry, or, that you haven't been eating as healthy as you usually do, and I'm worried about you. And so, so with that, and I just wanted to bring that up, and I wanted to check in to see, is everything okay? So I think doing it in that way, but really focusing on the behaviors, can help also for someone to feel less defensive as well. All right, so another great question here from Matt. So what's the net effect of moderate alcohol intake, particularly on anxiety, if drinking 1 glass of wine per day? So alcohol, certainly, there's always just this interesting information that keeps coming out about alcohol use, and it changes from, 2 drinks are okay, to then be careful of 2 drinks. And, it's kind of reminds me of coffee studies as well, where there's benefits, then not benefits. And so the thing is that, for some people, and I know that during this pandemic, liquor stores have been doing incredibly well. A lot of people are reaching for alcohol as a way of helping them to calm and settle themselves. And so, so it's something being mindful of that. We know that too much alcohol can begin to have effects on mood. the other thing that alcohol can really have an effect on is sleeping, and it can disrupt sleep cycles. And in particular, folks who may use more alcohol are at risk for having, like they can fall asleep easier, but then they're at a greater risk for having things like middle insomnia. So they'll wake up in the middle of the night. So it's something where I just, just be careful. Certainly, one glass a day, that's something that is usually within normal limits for, for most, most dietary recommendations. It's just, when it's becoming 2 or 3 or so forth, just being cautious. All right, great questions from the audience. Let's see. And oh, okay. I'm going to go to the chat for a sec. So let me look there, because let's see if there's anything there. So one of the, so I really appreciate, the one that Karen just shared. So I had a close family member die on June 16th, and the isolation has been hard. We could not have a proper funeral. I cannot come up with something I would enjoy. I will need to experiment, I suppose. Thanks for sharing that, Karen. I'm really sorry for your loss, and a number of folks that I've worked with have had losses, during this pandemic, and all of the usual rituals that many of us would do with the loss of a family member or friend, we can't do. And so so with that, making sure to connect, and I've seen some interesting ways. I've had some patients who've had done some virtual wakes as a way of celebrating, but also finding something, maybe starting even with a walk, or starting with one good thing, and that may be a way of starting to change your focus from the things that are so difficult to, well, what's one thing that I noticed during the day. So but thanks for sharing that, Karen, and please accept my condolences for your loss. So Karen has a question: are symptoms the same in young kids? So great question. And kids, kids are a little different when they're experiencing feelings of depression or sadness in particular, where they may not be as withdrawn, for example, as adults are. Rather, they can be more irritable. So you can see that irritability, agitation as well, especially in teens. You'll see that irritability and agitation, a lot more anger as well. And that can also be the case with anxiety as well. You'll see, that there may be those worries that are going on for kids, and you'll see crying as well. But once again, one of the things I like to use with kiddos is if you just Google like a feelings chart, that can be a great way of just finding out, what are kids' moods and how are they feeling. And it's something then, like I used to do this with my kids when they were younger, then show them like, okay, so how are you feeling on this? And then with that, and this is how I'm feeling as well. So it's a way of sharing feelings. But something to check in with kids, and because one of the things we are seeing is with their changes happening with school, with being away from friends, they're feeling down and they're feeling sad and they're feeling worried, and so with that, checking in with them is really important. Great. So nice question here from Kara Paget. So any advice on how to explain COVID and the pandemic to very small kids? Yeah, this is a tough one. And so, it's the big thing I think with little kids is you don't have to go into tremendous detail. and, really trying to provide as much reassurance as you can. I mean, there certainly are uncertainties, but providing in the reassurance of, when we wear masks, that helps us to be healthy and safe. When we wash our hands, that helps us to be healthy and safe. So providing those types of messages, connected with also behaviors that they can control, can help them out as well. Great question. All right. Let's see. Well, I think we're nearing the end of our time. So what I'm going to do now is just move. So first, I want to thank you all for just hearing me out and asking also great questions as well. In this, if you have any questions or comments, please feel free to reach out to me. So alex.reed@cuanschutz.edu. Glad to be of any assistance or help connect people as well. And with that, I'm just wanted to let you know so that, oops, I'm going to get out my comments. All right. So thank you all. Thank you all for your time this evening. And so I hope that you'll be able to join us for the next event in the series on September 9th, featuring Dr. John Adgate to speak on COVID-19 risk and personal protective equipment, protecting yourself and your family. And don't forget to connect with us on Instagram to check out stories about your fellow alumni, or at our newly launched CU Anschutz Alumni LinkedIn group focused on professional development. So just here are those resources. And just thank you so much for tuning in and for all you do as healthcare professionals for your campus and community. So thanks, and have a great evening.